Tracheostomy patient can't breathe alone, but opened eyes. What questions to ask in ICU? My name is Patrik Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power and influence, making sure your loved one always gets best care and treatment, even if you're not a doctor or a nurse in intensive care. So today I have a question from one of our clients, Josetta, who says, "Hi, Patrick. My sister had a tracheostomy a few weeks ago while still in a coma. Now the doctors are asking for her to get a PEG tube. They are saying that she has a severe brain injury and will need long-term intensive care. But yesterday she was able to go 4.5 hours on pressure support ventilation. She opened her eyes for 30 minutes today, but was unable to breathe on her own. So I don't know what questions to ask them. Please help me with the questions to keep them off my back. Thank you so much. I look forward to hearing from you." So, Josetta, thank you so much for your question. I'm really glad that you reached out because this is actually a really important situation that you're facing here. So, let's look at understanding your mother's current situation first. Now, your mother had a tracheostomy a few weeks ago. She's still in a coma, and now the doctors are pushing for a PEG tube. They're telling you she has a severe brain injury and will need long-term care. But here's what's interesting. Yesterday, she was able to go 4.5 hours on pressure support ventilation, and today she opened her eyes for 30 minutes, even though she couldn't breathe on her own yet. So you're getting mixed messages here, right? On one hand, they're talking about severe brain injury and long-term care or long-term intensive care. On the other hand, your mother is showing signs of improvement. She's tolerating pressure support ventilation for extended periods and she's opening her eyes. It must be confusing, and it's no wonder you don't know what questions to ask them. So the critical questions you need to ask the ICU team, and here are the questions you absolutely need to ask the ICU team to keep them off your back and to actually understand what's going on with your mother. Question number 1. What specific neurological assessments have you done to determine the severity of the brain injury? This is critical because they're making a claim about severe brain injury, but you need to know what tests they've actually performed. Have they done a CT scan recently? An MRI scan? What does it show? You need specifics, not generalizations. Question number 2. If your mother has such a severe brain injury, how do you explain that she opened her eyes for 30 minutes and tolerated pressure support ventilation for 4.5 hours? This is a really important question because these are signs of neurological function and respiratory improvement. If the brain injury is as severe as they're claiming, these improvements wouldn't typically happen. So you need them to explain this very contradiction. Question number 3. What is the weaning plan for the ventilator? The fact that your mother tolerated pressure support for 4.5 hours is actually really encouraging. Pressure support is a mode of ventilation where the patient does most of the breathing and work themselves. So you need to know what's the plan to continue weaning your mother off the ventilator. Are they doing daily spontaneous breathing trials? What are the specific parameters they are looking for? Question number 4. Why is a PEG tube being recommended right now? Can we wait a bit longer to see if her swallowing function improves? A PEG tube is a feeding tube that goes directly into the stomach. Now, it's not necessarily a bad thing, but the timing matters here. If your mother is showing signs of neurological improvement, her swallowing function might also improve. You need to know why they're pushing for this right now and whether waiting another week or 2 would make it any difference. From my extensive experience, you don't need a PEG tube. Your mother doesn't need a PEG tube. She can perfectly go with a nasogastric tube for months on end. PEG tube requires surgery. Nasogastric tube doesn't require any surgery. And a PEG tube is often permanent, whereas a nasogastric tube is temporary. And you want to start with temporary, not permanent. If she needs a PEG tube down the line because she can't wean off the ventilator and the breathing tube and the tracheostomy, then let's look at a PEG tube. But it's way too early. Their goal should be to wean your mom off the ventilator and avoid the PEG tube. Question number 5. What is the specific long-term intensive care plan you're envisioning, and what are the alternatives? When doctors talk about long-term intensive care, they often mean that she'll stay there until she's weaned off the ventilator. But you need specifics. What exactly are they recommending? What level of weaning? And importantly, what are the alternatives if she continues to improve or also doesn't improve? Question number 6. Has a speech pathologist assessed her swallowing function since she started opening her eyes? This is crucial because swallowing function is directly related to whether she needs a PEG tube long-term or not. If she is showing neurological improvement, her swallowing might improve as well. Question number 7. What is the prognosis timeline you're basing your recommendations on? Are they making decisions based on where she is right now, or are they factoring in potential for further recovery, weaning off the ventilator over the next few weeks or months? This matters enormously. Next, let's look at the importance of having access to all medical records. Now, Giuseppe, here's something really important. You need to have access to all of your mother's medical records, not just verbal updates from the doctors, but the actual records in real time. This includes all daily progress notes, doctors, nurses, physios, respiratory therapists, if you're in the US, all CT scans and MRI reports, neurological assessment, ventilation, weaning protocols and ventilation settings, all lab results, including arterial blood gases, medications list, and so forth. Why is this so important? Because when you have the actual medical records, you can see exactly what's documented versus what you're being told verbally. Sometimes there are discrepancies. Sometimes the records show improvement that the doctors aren't emphasizing. And critically, when you work with us at intensivecarehotline.com, we review these records daily and identify the questions you wouldn't even know to ask. So, how can a consulting call help you right now? This is exactly the kind of situation where consulting call with myself or the intensivecarehotline.com, where the intensivecarehotline.com team can be absolutely a game changer for you and your mother. Here's what we do. We can join you in on a call with the ICU team to help clarify what's really going on. We speak their language, we understand the medical terminology, we understand intensive care inside out, and we know how to ask the right questions that get to the truth of the situation. We can question their recommendations in a way that's professional but firm. We can advocate for your mother and make sure that decisions aren't being made prematurely. Because here's what often happens in ICU. Doctors sometimes make recommendations based on where the patient is right now, without fully factoring in the potential for recovery. And when families don't know what questions to ask, those recommendations can become the default plan, even if there are better alternatives. We can help you push back when necessary. We can help you understand the medical records. We can help you create a proper weaning plan. And we make sure your mother gets every opportunity to improve before any irreversible decisions are made. Let's now also look at long-term ventilation options with intensive care at home. Now, Giuseppe, here's something else you need to know about it. If your mother does end up needing long-term ventilation with a tracheostomy, there's an option that most ICU teams won't tell you about, and it is intensive care at home. And you can find more information at intensivecareathome.com. It's a long-term option to keep your mother out of ICU predictably and permanently if she needs long-term ventilation and or tracheostomy. And this would include weaning off the ventilator as well. Instead of being stuck in an ICU or going to a nursing home down the line, your mother could potentially receive intensive care at home with proper ventilation support, full nursing care, and all the equipment that she needs, and also with the right mindset. This is not something most hospitals will proactively offer because they're not familiar with it, but it's absolutely possible, and it can give your mother a much better quality of life. At intensivecareathome.com, we can help you set this up and make it happen. The key here is that you have options. The hospital might be presenting this as if there's only one path forward: tracheostomy, PEG tube, long-term ICU, but that's not true. There are alternatives, and you need to know about them before you make any decisions. So, what should you do right now? Here is what I recommend you do immediately. Number 1, request copies of all medical records especially the most recent CT or MRI scans and the neurological assessments, but all medical records need to be there, full stop. Step 2, ask the ICU team all 7 questions I gave you before. Write them down and don't let them brush you off with vague answers. Number 3, get a consulting call scheduled with me at intensivecarehotline.com. We review the medical records, help you understand what's really going on, and either join you on a call with the ICU team or prepare you with exactly what to say and ask. Number 4, do not agree to any long-term or nursing home placements until you fully understand the situation and you have explored all alternatives for improvement. And number 5, if long-term ventilation becomes necessary, explore the intensivecareathome.com option before accepting a long-term ICU placement or worse. Just said that the bottom line is the fact that your mother is opening her eyes and tolerating pressure support ventilation for extended periods is actually really encouraging. These are signs of neurological function and respiratory improvement. The ICU team might be being overly pessimistic, or they might be making recommendations based on incomplete information. You absolutely need to question what they're telling you. You need to advocate for your mother, and you need to make sure that decisions aren't being made prematurely based on where she is right now without considering her potential for further recovery. Don't let them push you into decisions just to keep them off your back. Your mother's life and quality of life are at stake here. Ask the hard questions, get the medical records, and get expert help from people who understand ICU inside out and who can advocate alongside you. And again, that's what we do here at intensivecarehotline.com. We help families like yours get clarity, get control, and make sure their loved ones get every opportunity to recover. If you need help right now, go to intensivecarehotline.com and book a consulting call. Send us an email or give us a phone call on one of the numbers on the top of our website. We're here to help you navigate this situation and make sure your mother gets the best possible care and every chance to recover. And remember, you're not alone in this. We're here to support you every step of the way. I hope this helps to set us, stay strong, and ask those questions, and don't back down until you get real answers. Thank you. Want more tips on how to advocate for your loved one in ICU? Subscribe to our YouTube channel for weekly videos on navigating intensive care, understanding medical decisions, and getting your loved one home safely. Go to intensivecarehotline.com for one-on-one consulting and support. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.